Welcome everybody to the Tuesday Facebook Live. I'm Kelley Alexander and I am the program director for the sanctuary at Sedona. I really appreciate you joining me. I've been doing this Tuesdays at noon. So today I wanted to talk about something that is one of my favorite topics and something that we share a lot about and teach a lot about at the sanctuary at Sedona, the holistic treatment center, trauma center for addiction and trauma that I work at. And it's a topic that we have coined a phrase. It's called a paradigm attachment disorder. And it's something that we see almost daily with the people that are coming in to get help with us. And it's something that I wanted to share a little bit about how it affects us individually, but I also want to talk about how it's affecting us globally right now as well. It's a disorder that can be incredibly limiting and keep us caught in a cycle of despair and hopelessness, even when there are choices and options for us that we don't have to be doing that. So first off, what is paradigm attachment disorder? The best way I can define it would be to give an example of what it looks like for when people that show up to the sanctuary. So a lot of times people that come to the sanctuary have been around the block as far as going to other treatment centers or other programs to treat addiction. And they have found that for whatever reason, they haven't worked for them. But they've been given the belief along the way that somehow they're defective or broken, that they're diseased, that they're genetically predisposed, meaning that they're basically genetically predestined to be an addict or have an addiction. The same thing goes for the people that come to us who have been suffering from mental health issues, people that have perhaps depression or anxiety or trauma. Similar messages, they've been out in the world and going to very well-meaning doctors or different programs, and they're also given a sort of a belief set that perhaps this is a lifelong ailment, that they're just going to have to learn the best way to function or how to symptom manage their life. So they come to us with really strong beliefs that they have picked up from very well-meaning people, basically based on maybe some science saying that they have genetically predispositions, or that basically this is going to be something that they have to live with for the rest of their life. And it's really interesting because when they come to us, we have a very different point of view. We believe in the science of epigenetics and neuroplasticity, meaning that even though we have a set of genes that can certainly express in various numerous ways, and let's say we do have addiction or alcoholism or depression kind of in our lineage, that maybe we have a possibility of having that, we don't feel like it has to be the probability, because we know enough about how epigenetics, how environmental factors, including our beliefs, 60% of our beliefs, affect how our genes express. So we believe differently. We also believe that we are creating new neural networks, that we are able to create new brain cells, that we can basically grow new bodies, that we can be recovered, that we don't have to be defined by, informed by, or stalked by any past diagnosis, any past behavior, any past coping strategy. And we believe this because of, like I said, the science that proves this, and because we've now seen it for 13 years, 15 years in our own lives and the people that come through. But what's really interesting, and this is where the paradigm attachment disorder comes in, we sometimes will have people come in and they are suffering, especially if they've been given a diagnosis, let's say of bipolar or, social anxiety, and they have been plagued by this. It's caused incredible suffering and loss in their life. And they have this diagnosis, and they've been taking medication possibly for it, or certain kinds of therapies for years. And it has limited their life in different ways. And so then they come to us, and we tell them, wow, um, the diagnosis might be a source of information, but what if we could give you some tools and practices and data and new information, that everything you believe about yourself and your diagnosis and your identity with that isn't true. It isn't true. Are you open to that? And although most people, of course, that come here are, we every now and then will get some people who will dig in and want to defend their diagnoses, that want to hold tight to their identity of being an addict or depressed or traumatized. They want to hold on, and they will argue with us or put up resistance with this. And it's so interesting to me every time that happens, usually within a week of giving them some information and starting to feel better and having what we do work, they are able to kind of shift that. But initially there might be this resistance. I saw the same thing happen to me personally. I went to a spa, detox spa, for some my own health issues in California a few years ago. And a lot of the people that came to this spa came because they were looking for alternative holistic ways of getting better and healthy. And the woman that runs the spa is an expert. She's in her late 70s and is very well known. So we're sitting in this circle, and she's talking to us about anti-inflammatory diets and also allergens such as dairy and lots of different things that maybe we were doing that were part of why we were now seeing her, because we weren't feeling well. And I remember distinctly a gentleman, very overweight, and I know he had diabetes and had come for some other health issues, that started vehemently defending and arguing his use of dairy and his use of gluten. And it was super interesting because he went on for about 10 minutes. And as I was watching him, of course, part of me is thinking a lot of judgmental thoughts like, wow, why is this guy doing this? And then I guess the higher part of me was looking with curiosity, going, wow, that's really interesting. I wonder where I do that in my own life too, and why. There's a psychological term called cognitive dissonance, which is kind of similar, that we have a set of beliefs that we often are given through culture or our family of origin, or we create often even through trauma, or we're given information and data that might make sense at a certain time in our life, and we create a world around it. For instance, like I had mentioned, people with diagnoses, they've created a world around the certain medications and what they can do and what they can't do, and the limitations of who and what they are. We can see it in society if you've been given a message or a belief about how you need to express your sexual identity, or a way that you need to worship a deity, otherwise you'll go to hell. Or we learn different beliefs about what it is to be a successful, worthy person in our culture. Any of these things, get these beliefs, and then we create our identity and our entire world around them. So we have a lot invested in these beliefs. We've made choices about maybe our careers, our partners, how we look, the food we eat, the activities we participate in, the belief structures. We are willing to perhaps endure certain things that maybe we wouldn't if we believe differently. So I think you're getting sort of the sense of what I'm saying. We've developed a reality around these sorts of belief structures we have. The paradigm, that's the paradigm. We have a paradigm, a way we see the world that we become very, very invested in. Now, you would think that if this paradigm also involved some suffering, some fear, some ways that we're perceiving ourselves in the world as disempowering, that there would be a part of us that would be desperate to be open to possibly having our paradigm be shaken up a bit. We would want new information that could perhaps alleviate our suffering, and could eventually lead to more freedom, more liberation, more joy, more connection. You think that sort of makes sense. But being the complex beings that we are, it's more of a both and, that there might be a part of us that wants our paradigm, our familiar, safe experience of ourselves and others, to be shaken up because there's pieces that are out of alignment, that are not in the dissonance, the cognitive dissonance. At the same time, we have become very familiar and comfortable in this paradigm. And so when we might get new information that will possibly offer us some liberation, it would also offer us some change. And there is absolutely so much science that even talks about this. There's a deep part of us, maybe it's part of our survival, part of our being, where change can be very frightening and very dangerous. A lot of studies show that we often will stay in the known familiar misery rather than go out into the world to make changes, even though we know the changes might offer us a whole different reality. And so it creates a huge amount of psychological stress, fears about maybe changing, even though we desperately want to. That's sort of this both and um, situation where we want something, meaning we want the paradigm to change, and yet we're very attached to the paradigm because of some deep fears of shaking it up and what that might mean. And of course, also, when you think about it, if we've invested a lot in a belief structure and all of a sudden we're told that possibly we didn't need to, or there's other information, I think most of us, are so ingrained with criticism of ourselves. We don't want to feel shame or blame, like we did something wrong, rather than looking at the fact that we may have been working from that paradigm based on the greatest level of consciousness that we had, on the best information that we were given, on belief structures that were being supported by our families or culture that we didn't know that we could even resist or argue with, that we're always doing our very best based on the information that we have. So therefore, there's really no reason when we get new information and we need to change course to beat ourselves up. But so many of us, that's what we do. We feel like, wow, you mean I didn't have to be, you know, taking that pill maybe as long, or all those pills, or maybe I didn't need to avoid these circumstances, or I didn't need to be identifying myself as a label, or I didn't need to be staying in these kinds of relationships, or doing this kind of work, or sacrificing in these kinds of ways, had I had this other information. And that's just part of our journey, and I really want to stress that. I think paradigm attachment disorder is ultimately a coping strategy. When we've been given information and we've invested so much time and money and our identity, and we've invested maybe our own family's welfare, all of this, into seeing and feeling a certain way, to then be given information that might in some way make us look like we made a mistake or could have done it differently, we judge ourselves horribly. So I want to say I don't think we could have done them differently. We choose a paradigm, we choose a way of living and being, not because we're stupid. I mean, we're like I said before, we're doing this based on the best information and our own level of awareness and consciousness, our trust, and that public figures or our doctors would be telling us the latest information or the latest science, that we trust that. So really want to put out there that when I'm talking about, isn't it all a finger wagging, shaming, or blaming message? Like, gosh, how could we have believed that when this new information is telling us that that's, maybe not the full picture or not accurate anymore? No, not at all. That's just called growth. That's just called maturity. That's just called, kind of this evolutionary process that we're in, that we have a way of being that works for us. And then we're open for the fact that we can get new information in to make our lives so much greater, so much more. And I'm really fortunate because I get to see this every day. People come in with a small definition of who they are, and they're not worthy, they're an addict, they're depressed, what they do is never enough, or they've been told that who their authentic expression is of themselves doesn't fit well into society's box, so somehow there's something wrong with them. They have all of these beliefs, these paradigms that they have taken on or chosen to have, that they've invested a lot of their life in. And so even though part of them is desperate for a new one and a new paradigm, they might be initially resistant, but pretty soon they become open. And, within the time they leave, all of a sudden they're like, wow, I've got new information. I didn't know about epigenetics. I didn't know about neuroplasticity. I didn't know about how to, heal my gut so that I, aren't inflamed and I can start thinking clearly. I didn't know that a lot of the beliefs that I have taken on, I took on before I was 7 years old, and didn't have any filters to decide whether or not that works for me or not. I didn't know that I could go out and do my own research and gather data that might broaden my perspective of myself and my life. And so people leave here in a much bigger place. They see the world differently. They feel whole. They feel hopeful. And it's a beautiful, beautiful thing to see. And that's why I wanted to really share this with the community in a more global sense. Especially right now as we're all sharing together this, COVID-19 crisis together, that I know a few months ago, we were given the imperial model of what this pandemic was going to look like. And I believe everybody, in the very best of intentions, wanted to keep this world a safer place by coming up with certain precautions based on data they predicted. And we're really fortunate now that 2 months into this, we have data. We have data. We have data from Europe and China and the States. We're gathering data about, actually the death rate and how many people are the cases are getting it, but how to interpret the cases. And I can tell you, this data is so hopeful. It's so hopeful. There's no denying that there is a virus, but when you hear the data that's coming out and the new information, I just get so hopeful myself and just want everybody to be able to be open to hear it, so that they can then maybe decide for themselves how they may want to go as they go forward, react and respond, that may not have the collateral damage and the despairing results that our initial response, which made a lot of sense initially, the sacrifices that we thought we were having to make made sense initially, but maybe now with the new data and the new science and everything else that we're getting, we may be able to change trajectory and be able to not have to respond and be caught in this lockdown of internal lockdown and external lockdown of fear. I do want to invite all of you to look at, and I will put this in the link on my feeds here, but I wanted to really give some wonderful information that I had received. I know that a lot of times there's been a lot of contradictory information, which is just creating more confusion and cognitive dissonance, a lot of arguing. People feel like there's fake news, fake science. They feel like some of the doctors that are coming out are controversial and have agendas. And so a lot of people are just sitting at home more overwhelmed and flooded than ever. So I would just like to give one link of doctors that are without blemish, meaning they're not controversial. Tony Robbins, who many of you know as an inspirational, motivational coach and teacher, wanted to get together a group of doctors and scientists that would be where nobody could argue with them. Like they were credentialed and considered legit, mainstream. So he found a panel. One's a Nobel laureate in epidemiology, some professors from Stanford University, an MD and a senator from Minnesota. So people who have no agenda, meaning they're not anti-vaccine or pushing one thing or another. All they did was want to talk to people, to tell them about the virus and who's at risk and what are the best precautions and what does the data analysis look like now. And it is such a wonderful source, such a wonderful, calm, measured, non-inflammatory source. And I just would invite all of you to take the time to listen to it and, of course, then make your decision. And would also invite all of you to also check in if you're taking in this information and you're having sort of an angry or more highly charged reaction, to just check in to see if possibly you might be running up against your own paradigm attachment disorder. I'm very humble. I have to check in with mine quite often when I have that initial no, even though I'm getting information, to stop and think, well, why? Why am I not even open to listening to something different? And to really also, if those of you who listen to this information, to remember that it's okay to change our trajectory, that just because we had a belief system or a paradigm that felt very real and that we made choices, that we don't have to be angry or upset with ourselves or anybody else if we choose to change paradigm based on new information. That doesn't mean we were foolish or stupid or people were giving us on purpose wrong information. We don't need to feel badly that some of the measures we've taken may have had consequences that we wouldn't want had we had this new information. That's just part of, like I said, the information gathering process. It's just part of our human growth process. So again, I just wanted to, leave it at that paradigm attachment disorder is alive and well in all of us. There's nothing shameful about it. It is a coping strategy. It is a way for us to try to manage our world and also defend choices we make so that they, feel good, like we can feel good about ourselves. And in these times, it's okay to be open to taking in new information, changing trajectory. That is just a beautiful process of growth and development. And it's more important now than ever. I would just think to all of you, especially those of you still in a lot of fear, don't you want the information that might lessen that fear, that might put it in perspective so that you and your family may not have to be suffering to the depths that you're suffering right now, and that you might be able to get back into some more freedom and some more liberation in your life. So again, thank you so much for just spending this Tuesday lunch hour with me, and really look forward to speaking with all of you next week. Really invite all of you to be checking in on Friday at noon for Dean Taraborelli. He is the founder at the Sanctuary and one of my most inspirational speakers. Always love what he needs to share from his own heart and soul and his experience here at the Sanctuary. So have a beautiful day and a beautiful week. And be curious. Go out and broaden your horizons and question your paradigms. Take care. Bye-bye.